The notion of taking tumor tissue from a patient, it was their tissue, and taking their own cells from them, bringing both those into the lab, modulating them, approximating them, introducing them to one another inside a little culture dish in a test tube, if you will, and then modifying it using true biological non-toxic agents, and then giving it back to the body as a little gift is just incredibly representative of the true philosophy and depth of naturopathic medicine, and hence naturopathic oncology.
Hi everyone, Dr. Matt Halpert here, founder and CEO of Immunocine. We've been going around talking to different doctors in the space of cancer immunotherapy, alternative and standard, and we're just getting to know them a little better and learn more about things they've seen over the years and how they're seeing the advancements come about in the world of cancer and various cancer treatments. Joining me today is Dr. Dan Rubin, a naturopath oncologist who's been in the space for over 30 years and certainly has seen and experienced a lot. We actually had the opportunity to meet around a particular patient that was coming to Immunocine, and in working with Dr. Rubin both before and after the Immunocine treatment, she's done just phenomenally well. Stage 4 breast cancer, about 40 tumors throughout her skeleton, including some in the skull. We're about 5 months out at this juncture, and she's down to only 2 remaining lesions, which do appear to be improving. So she's doing great. She's in much better shape than she was, in large part thanks to working with Dr. Rubin to get her immune system really primed and responsive to this treatment. So Dr. Rubin, thank you so much for joining us today. I know you've been very busy, especially with winning Physician of the Year last year in 2024, and I know you're booked pretty solid, but it's always good to get to know doctors around the country that are working innovatively in this space. And so just thank you for joining us today.
Yeah, my pleasure. It was great.
All right, so we'll just jump into some things. And you've been doing this a lot longer than Immunocine has been around. You've been in this space for decades, and you've seen a lot of things. I know that you're a big believer in the immune system and the power of working with systems and a person's own biology, but maybe you could give all of our listeners just a little bit more background on you and how you came to be in this space and what you've seen in the last many years.
I appreciate the opportunity to talk about that. You know, I have a degree in basically existential philosophy from University of Iowa. And so how did I find myself in the medical space? It was really because back in the early 90s, I developed a keen interest on health as an athlete and early on triathlete. I started working in a health food store and got to know a guy named Philip Lansky, who now goes by Ephraim Lansky because he's an MD and a PhD, and he's the one that had offices adjacent to the health food store and would do a lot of ordering, and I would place a lot of his orders. So I got really interested in this, started getting interested in, human physiology. I didn't have any science classes except astronomy in college. So he told me about naturopathic medicine. And fast forward several years, 1994, I found myself moving from the Chicago area to Arizona and became a freshman at Southwest College of Naturopathic Medicine, graduated in 97, and really found that oncology was of great interest to me because it really encompassed all of human physiology and all of human anatomy. I mean, nothing really was spared from the scourge of cancer. And it was a lot different back in the 90s than it is now. Oncology has really been on fast forward. In the late 90s, I was fortunate enough to find myself in the realm of immunotherapy, and specifically dendritic cell therapy, knowing that understanding deeply the world of oncology and human physiological thinking and how cancer develops, what we knew in the 90s and how our body is meant to take care of it. The immune system is truly your first and last defense. And when somebody allows a tumor to grow for whatever reason, there's been some type of failure, so to speak, on the immune system, whether or not the cancer is just too, what's the word that I usually use? Seductive. Cancer arises from oneself, and cancer can be very seductive. And is it a good versus evil? Is it the immune system is like, okay, we see you yourself. We don't really want to kill you. You're not dying for some reason, so maybe you're okay. We're going to give you the benefit of the doubt. And then, this malignant cell, this somewhat evil cell, so to speak, grows. And so I found myself practicing and met a guy named Neil Reardon who had a dendritic cell technology, and we opened up a clinic in Tempe, 1999. So it was in the 90s, and really began to dig deeply into the immune system. And we, in our laboratory, were creating personalized immunotherapies. This was in Tempe, Arizona. All in all, looking back, it was just about a 4-year effort that we had together. It just didn't work as well as it was supposed to on paper. And we tried other methodologies. We created autologous cytokine soups, if you will, from different types of white blood cells, and we would use those on patients. It was all autologous, meaning from themselves. We did testing back in the 90s and early 2000s. This was really advanced stuff, especially in the private clinic outside of an academic institution, although we had immunologists from well-known institutions that were helping us and doing our testing and helping to guide us. It just didn't really pan out. My love for the immune system never faded. And using dendritic cell therapy was not the only technique that we used. And making these types of immunotherapies wasn't the entirety of our practice. I mean, we used other immunoadjuvants that we would either inject or that we would illustrate some other way to the body. Fast forwarding now to here we are in 2025, and I was introduced to Immunocine's technology last year in 2024 by our patient that you talked about in the introduction. And I understand much more deeply now why our single loading approach, as well as, where we attempted to get antigen from, which we could get into, how it differed so vastly from the procedures that Immunocine uses based on the work that you and Dr. Decker and your group has done and published. And so I get it now, which is why I'm so on board and so enthralled, not just with the initial platform and the initial technology, but where through our discussions and through my care of patients that are at Immunocine and interacting with other physicians inside your group, where it's going and the ideas and the ingenuity. And it's an incredibly exciting time in the world of this type of medicine, because what are you doing? You're educating the immune system and putting it back in the body and saying, okay, this is how you normally do it. It wasn't happening. Have at it. So it's really exciting to see, especially with my background and seeing what could have been and what is now.
Yeah. Obviously, immunotherapy really became, in a way, revitalized in 2011 and 2012 when the checkpoint inhibitor explosion really started. But before that, do you remember any interesting or maybe weird attempts to use the immune system to fight cancer? Did anything come to mind just from way in the beginning, other than what you were doing? Just some things out there that have been floating around that you saw that really piqued your interest for one way or the other?
Yeah, I mean, other ways to engage the immune system. Some people relied on viral vector therapy, which I didn't jump into that. I had some patients that went to clinics outside the United States. There were other attempts at dendritic cell therapies outside the United States that some of my patients looked at, and I helped guide them through. Nothing really successful. There was a gentleman, Hal Gunn, who I still keep in contact with. He's outside of Canada, and he developed a technology called site-specific immunotherapy, which I thought really had great potential. And it was we really didn't have access to it at the time. I understood the potential there, and it was based on a bacterial vector, and it was site specific, so it was based on certain places in the body. My patients weren't able to use that. I know it's in clinical trial now. That was of interest to me. Back in our early days at Aiden Clinic, when I was working with Neil Reardon, at that time we were starting to look at LAK therapy, so for the listeners out there, lymphokine activated killer cells. It was just really starting to scratch the surface, and it was fringe at the time. But nothing is technologically advanced in terms of mimicking what actually happens inside the body is the double loading that Immunocine does now. So, but then there was goofy stuff that was out there that was sort of the beginning of the hypester era and influencer era, even though, and I remember, and this predated 2011 and the checkpoint inhibitors. This was before we had social media and influencers, come in different shapes and sizes at that time. But people were really looking for something, and they still are looking for something to grasp onto, which makes it difficult for patients, which is part of the reason I'd love to talk about the Oncology Association of Naturopathic Physicians that we started and why we did that. But going back to 2011 and 2012, I remember when checkpoint inhibitors came out, and I remember literally our group, we were terrified, to say the least, of, okay, well, what do we do? Are we allowed to still give melatonin? Because this, checkpoint inhibitors at the time were a T-cell therapy, and melatonin can stimulate and, upregulate high affinity interleukin-2 receptors, to get technical. And so we weren't sure exactly what to do. And so we crept along. And those of us that had relationships with medical oncologists or MD colleagues, and I was fortunate enough to be able to submit my protocols alongside the clinical trial protocols. That's just the world that I was living in at the time. And so the pharma companies that had brought these out and weren't ready for commercial use yet, but were still in clinical trials, allowed us to submit our protocol. So we learned along the way what ended up being safe, and we continued to learn, along the way. So it was a wonderful time to be along for that ride and to really see the birth of that and to learn alongside it. And all of us were learning at the same time.
You were looking at dendritic cell biology back in the 90s, which is interesting. And maybe you could give a little background as to what interested you at that time about dendritic cells and their potential use in the clinic, and then just what really excites you now about where we are with dendritic cells, now in 2024, 2025, compared to way back then.
Thank you for asking that question, especially as a naturopathic oncologist. Why I was so attracted to dendritic cell therapy or using cellular-based therapy, especially autologous therapy, meaning the patient's own tissue, was because it was true naturopathic medicine. In naturopathic medicine, we take an oath to several precepts: the healing power of nature, treat the cause, treat the whole person, doctor's teacher, prevention is the best cure. These are precepts that line the halls of our medical schools on banners. These are things that are on our diplomas. These are what we take an oath to, and it's what we learn the first day of naturopathic medical school. Mine was in 1994, and I remember learning it. It's the philosophy of naturopathic medicine. Dendritic cell therapy fits entirely and beautifully well into that construct. So it was de facto that I would like this type of therapy, and that's why I was attracted. The notion of taking tumor tissue from a patient, it was their tissue, and taking their own cells from them, bringing both those into the lab, modulating them, approximating them, introducing them to one another inside a little culture dish in a test tube, if you will, and then modifying it using true biological non-toxic agents, and then giving it back to the body as a little gift, is just incredibly representative of the true philosophy and depth of naturopathic medicine, and hence naturopathic oncology. It isn't anything else. It's true nature. Looking forward now, what excites me about it now is that I never lost that desire to continue to try and engage that type of immune response inside somebody's body. It is what is supposed to happen. The question is, why didn't it happen? I don't know that we're not there yet. There's a lot of external influences coming into people's bodies that can impact the normal immune response and make it not happen. We're getting there. We're identifying those.
Obviously, we figured out step one. we figured out that you have to double load the dendritic cells to actually get them to turn on and engage. And of course, that's what we're doing with Immunocine and in all of our clinical trials. It's in all of our publications. It's in all of our patents. The whole premise is that if you don't double load dendritic cells, you've missed step one, they don't work. So the whole foundation of everything we're doing is making sure that we're properly engaging these cells correctly right away in the beginning so we can get a phenomenal and physiological response. But while that's great, there's so much more that goes into a patient, right? Biological diversity is massive. If you take 2 stage 4 cancer patients, they're not the same. Even if they have the same cancer nominally, maybe they both have prostate cancer. If they're stage 4, they are not the same at that point. The cancer spreads to different locations, can be growing at different rates, can have slightly different mutations, let alone all their different background, their different treatments, the different things they've been exposed to in their lives. I do think sometimes we undervalue biological diversity when trying to come up with a treatment for a patient, which is why a one-size-fits-all is nice in theory, but very difficult to get to, and why personalized medicine has become so in vogue right now, because it makes sense. So, we have ways to work with a patient to truly narrow in and get things that are effective. But I guess speaking of engaging and empowering a patient's immune system, with the obvious disclaimer that everyone should be treated on a case-by-case basis. Everything should be personalized due to biodiversity. But with that disclaimer in place, do you have things that rise to the top in your mind, your kind of go-tos when you're dealing with advanced cancer patients that you more often than not see help? Is it truly just a one-off for every patient where it is just literally different for each one, or are there some things that become consistent or things that you've seen that help more patients than don't?
Well, it's a great question, because somebody can have advanced cancer but not be sick, which is an interesting concept, right? Because we could have a gentleman with metastatic prostate cancer at stage 4, but they have a single lesion in the top part of their hip where they place their hands. They didn't even know it was there. It doesn't give them any pain. They're still advanced, but they're not sick and they're doing everything. And then you could have somebody in a very similar situation, but is devitalized for so many other reasons because they have multitude of chronic illnesses. So I think for this question, what we're talking about are the people who are devitalized, who have been through much treatment and are coming to see us. They have advanced cancer, but they also have disintegrated health. And for that person, or for the person that has low bulk disease but still has advanced cancer, one of the biggest questions that I ask people is, well, do you want to live? And it's a really interesting answer to get. As a seasoned physician, I think I'm seasoned enough now that I can call myself that. I feel justified in being and tenured enough to not feel odd asking a patient that, due to my experience and having seen so many people. So it starts with the desire to want to live, which helps make treatment work better. Then you have the doctor-patient relationship. So our clinic is called Naturopathic Specialists, noting that we're specialists in naturopathic medicine. We're also specialists in oncology. But our tagline is personalized medicine, personalized care. And the title of our website, our URL, is listenandcare.com. The medicine is what happens when they're talking to the doctor and we develop protocols, or maybe they get a treatment or they take a supplement. But the care is everything else that's given by the clinic, all the communications, all the time they think about us or me or our nurses or our front desk staff. And so that, to me, that community that we create, which is engaged with the N of one patient, which you're talking, each person is different. The disclaimer that you gave, ubiquitously, it's such the most important thing. It's not the same as suggesting supplements and then they swallow pills. That's the easy part. It's the heavy lifting things. It's deciding whether or not they need to have a lifestyle change. And that could be pretty deep because it might be on the mental emotional level, spiritual level. It might be on the exercise level. For some people, I mean, we have some patients that they cannot walk 2 blocks. So how do we start that? How do you get them going? Because without the opposite of movement is death. We have rapid eye movement, bowel movements, our heart moves, our blood, lymph, et cetera, and our immune system certainly moves. So without movement, it's difficult to move somebody towards the continuum of health and death, towards the health side. So we have these discussions, and we have a multitude of practitioners in our facility that can help people achieve this. So it's a start, especially when looking at Immunocine immunotherapy. We need movement to get those cells. They understand the biology of the body. Once those dendritic cells are placed in the body, the healthier the vessel, the better they're going to do. I mean, I know I've referred patients to Immunocine, and some of them were simply not candidates for the treatment because of what their labs look like or their performance status, knowing that, it's incredibly responsible of Immunocine just to not just take any of our patients, to really go through an engaging and medically imperative and informative selection process so that Immunocine is really just using the treatment on people who actually have a good chance of it working. I mean, it's expensive in time and energy and financially for people to go down there for it to, and why give somebody hope when Immunocine might not think it's going to work? So I love the idea that Immunocine in your group goes through that process. So as a responsible physician, and for all the other practitioners out there, or those people that are listening that have practitioners that you think should listen to this, it's important, if you're hoping to go to Immunocine or apply that, you do get your vitality up. I mean, some of our patients simply don't eat. They can't eat. Or what they can get in their mouth and digest isn't vitalistic in nature. You think of what are some of the highest expressions of a plant food, like berries, things that have photonic energy, and that when you incorporate it into your body, it's at a high vibe. And I'm not talking hippie language. I'm really talking about vibrational energy. That is also, when you bring it into the body, the immune cells understand that, because the immune cells, you know this better than me, but they understand what comes into the body, how the body thinks. They understand what you think. And they're the only mobile tissue in the body of nucleated cells that can go and knock on the door of other tissues. Everything else just stays in its place except the immune system. They have contact with the bone marrow, one of the essences of sort of like the physiological soul, if you will. I mean, they have access to whatever they need. So that tangent, being gone off on, and getting back to the question about what is it, what are some of the fundamental things that I look at when treating people, especially people with advanced disease, is getting the fundamentals back: movement, swallowing, chewing. I talk about chewing. Some people don't chew a lot. They have liquid food, or they're fed, via IV like TPN or a tube. Still getting the chewing. When the teeth clap together, the neurological signals that get sent up to the brain via the gums, those are really important for the brain, the body, to understand that they're living. Chewing food, we take it for granted, but chewing food and swallowing food is incredibly important. So those things are incredibly important. It sounds simplistic, but sometimes it's incredibly difficult to achieve in the clinic. And so we keep pounding on.
Sometimes the best things, they end up being simplistic. And I think we overthink ourselves sometimes, and we think, no, there's no way it's that important to drink water. I mean, everyone knows you've got to drink water, right? It's too simple. You've got to get good quality food, good quality sleep. I mean, all this stuff is just so simplistic, and cancer's so complex. So we tend to think that these simple things don't matter, when of course they matter tremendously. There's a reason they're the basics. So I think we would agree it can be very complex, and there's a lot of information out on the internet, Facebook, YouTube. And once someone has cancer, their friend's mother becomes an expert in it, and everyone they know, and then someone on TikTok has something to say. And I probably would advise, in most cases, for most cancer patients, to, whether it's with a naturopath or a functional medicine doctor or a good oncologist, you want to engage an expert in this space who has made it their life to study and know these systems, to know what's really real. Because I can only imagine lay people that are not experts in cancer suddenly drowning themselves in information. Some of it might be good, some might be bad, and a lot of them are they're looking for that $30 bottle of pills that, hey, if I just take this supplement, the cancer will go away. And it's just not likely. And so before we see this we see this too. We see patients come with grocery bags of supplements, and it's not that they're all necessarily bad. It's just you need a plan. You need a plan of attack. Some people are very smart. And this is not a blanketed statement, but for probably most people, you're going to want to engage an expert such as Dr. Rubin here to help assist you. Really look at your labs, really get into it. Look at your organ function, look to see what's missing, look to see what's failing, because that's what we need to address. So that's my tangent based on what you said. Yes, there are some simple things. Everyone go drink water, get good sleep, eat healthy food. But cancer is complex. I know I'm reiterating and repeating myself, but I don't want this point to be missed. It is complex, and the idea that a complete novice would be able to just simply go online and learn everything they can and then match that up specifically with their cancer is daunting. Find an expert, a trustworthy expert, and work with them so you can really, truly hone in on a plan and have a goal in mind.
Well, no, it's a great point because even though histologically or on the pathology form, it's, cancer is looked at as a single cellular disease, but it's not. It's clearly not. It's a whole body disease. It arises differently in each person, hence the N of 1 that you were talking about. And so the complexity absolutely is there. And thank you for saying that, because you're protecting the public by saying, hey, there's a lot of hype out there on social media, and there's a lot of access to supplements. And if you don't have any background, it's easy, especially if somebody is apprehensive or scared or frightened or just having a diagnosis and wants to act quickly, to have access to something that maybe seems like a panacea, but it's just hokey and it's not going to work. So I think, and that's why we started the Oncology Association of Naturopathic Physicians. That was 21 years ago. And the idea was to protect the public. Back in 2004, and obviously the couple years leading up to that, oncology sort of got put on fast forward. There was new classes of drugs coming out. We were heading into this immunological era, and recognizing that there was the era of naturopathic oncology and naturopathic medicine, functional medicine, other health practitioners. This was starting to really burgeon as well as we came out of the 90s, and people were having more access, and they were looking to consume this type of medicine more than they had in the past. It was looked at as more legitimate, and that's part of what I've spent my career doing, is helping to legitimize and bring what we do into a world that we now call integrative medicine, integrative oncology. The reason for the development of the Oncology Association of Naturopathic Medicine was to protect, naturopathic physicians, was to protect the public. So we formed an organization and eventually a board certification process to invent, at the time, the naturopathic oncologist, which was fully invented in 2006 when the first 6 of us went through the first round of certification. I was in that, of course, and I presided over that, over the Oncology Association for the first 5 years. But it was to protect the public so we legitimize, and people who were looking to consume this could be protected and say, okay, like you said, these are the experts. And we are. And you're right, it is dangerous. Just like there are other types of immunotherapies out there that are dendritic cell therapies, they're just not double loaded. And there's other types of immune therapies out there that may not do what they're intended to do. And how does the non-discerning citizen or patient or person with cancer, how do they know where to point their, north-facing compass at? What do they do? And so I appreciate you talking about skilled physicians in this realm.
So, okay, on that note, you mentioned having patients that have left the United States and have gone to Mexico or these other clinics, and I'm sure you've seen a lot of them over the years that are probably less than reputable. Unfortunately, I've seen several of them now, so I know they're out there. I phenomenally am very appreciative that you've come to vet us multiple times to meet our team, see how we're doing things, to make sure that certain things are in place so that you as a practicing doctor can faithfully represent this to your patients as a good, legitimate effort. I wish everyone would do that, but we're providing obviously a legitimate science, compassion, great care. it's important. So, were there things that jumped out that make sense to share to other people who may be listening to this call right now when they're looking at maybe opportunities abroad that they could go and, maybe get some extra help?
Oh my God, absolutely. I mean, first and foremost, it's the care that the a care team to provide the patient. And like I talked about earlier in this broadcast, it's the vetting process, making sure that you're going to have a patient come down, you're going to be able to take care of them, and the treatment has the potential to work. So that's number one. So I really appreciate that you at Immunocine have a big team and they're oncology focused. You have medical oncologist, a practicing medical oncologist looking over every single patient, interventional radiologist, not somebody who's skilled in their art to be able to deliver the cells when they're ready to be delivered. They're not just being injected in the skin, they're being deposited nearby relevant lymph nodes under ultrasound guidance. And not every physician can do that. You need somebody specialized in this, and also somebody who can, actually get tumor tissue, like Dr. Viramontes does, legitimate tissue to be used in the immunotherapy. Because if you grab the wrong tissue, that wouldn't be very good. Dr. Ellie and just the whole medical team and the way that you guys care for the patient. So this gets back to me as their referring physician. I understand. So that's number one. Number two is science. Is there science? And if so, what type of science? And what type of publications have there been on this type of science? I know the clinics in Mexico, but I know that there's science because I know that there's a US venture that's doing clinical trials, and the protocol that's used at Immunocine is the same science. It's the same type of lab. It's the same science. And so that gives me huge confidence, especially because I can go and read published papers, published out of the United States. So that really gives me confidence. The other thing is recognizing that people are interested in results. It does, and not cherry picked results. It's all end results. And I've seen you share with physicians and patients, and myself included, results just how they are, not cherry picked. They're not case reports. They're, hey, here's where we are with all patients, and here's where we are in 2025, and here's where we are with certain types of cancers that we've treated in people. Those three things: the care of the patient and looking at the team, based on scientific principles. It wasn't just something that you made up and thought would work. And recognizing that results matter and it's helpful to show patients. Those are three really big issues when selecting a place to refer a patient.
Yeah, well, I appreciate hearing that. I mean, of course, we try to make it easy. We're aware that we're up against it. We have to try to sell. If you can't get in the clinical trial, which we have several going on, and we always send candidates to clinical trials first if they fit. But if you can't get there, you can come see us in Mexico, and this raises alarm bells, and I certainly understand why. We're pushing dendritic cells, which have a long history of failures because, before they were actually being used correctly, they were being used. And thus nothing happened, nothing worked. And so there's a dogmatic thought in place that dendritic cells cannot work, which is incorrect, but something we're up against. Obviously, you've visited us. You've seen that we're doing this kind of top notch, the way you would run any first-rate industry effort. We're not cutting corners in the lab or with certifications or with quality control testing. So the dendritic cells we utilize, we make, we administer are different. And I'll just blatantly say superior. And that's because that's what the science says. And of course, we're also up against it with being in Mexico. And we openly talk about the reasons why. That's on our site. There's some YouTube videos. It's not quite as crazy as it first seems, but unfortunately, there is a stigma associated with Mexico. So it's another thing we are up against. And so again, it's good to have doctors such as yourself come vet us and say you've seen what we're doing and that it's legitimate. We're trying to get the word out there. We're trying to figure out the ways to be faithful to the data and as diligent and transparent to patients. So as we wrap up here, I, again, want to just thank you for your time today. I want to give you the floor here at the end. I have a chance to communicate to untold numbers of cancer patients and maybe their doctors or their family members, all that are watching now. What would be a message that you would want to share with them here before we sign off? Floor is yours.
Well, thank you for giving me the floor. Life is sacred. In essence, you only get this life once. And if you find yourself in a situation where you have cancer, and especially advanced cancer, or if conventional treatment doesn't seem to be working for you and you're in decent shape or you want to get in better shape, and I mean physiologically, not just physically, and you're looking for something that makes biological sense, is biologically relevant, is based on science, I think really take a look at the immune system. So often people will come to our clinic and say, well, can you treat my immune system? Or they'll fill out in their paperwork, we ask a question, what have you know of our approach? Or what are your goals from, working with Dr. Rubin or Dr. Coates and they say, well, I want to strengthen my immune system. I know that they treat the immune system, and oftentimes what they mean is the whole body. But the big buzzword out there for people who are not in the industry but are looking to consume this type of integrative care is about the immune system. But Immunocine is really and truly about the immune system. So educate yourself on what the immune system really is and what it really means, and how to test it and make sure that you're doing a good job. And if you're thinking about immunotherapy in the cellular sense, really take a look at Immunocine. You're welcome to reach out to me at listenandcare.com. That's www.listenandcare.com. We're on social media as well. You look up Naturopathic Specialists. You could look up Dr. Dan Rubin. We have a podcast. It's called Rubin on Point. It's on all the platforms. We have videos. Just be careful. There's a lot out there, and make sure that you check into things and that you have a doctor that, like Dr. Matt was talking about, knows what they're doing. This is cancer.
Yep. No, excellent. Excellent words. It is a fight, and you want to use all these weapons that you have because it is cancer, and we don't want to leave important stones unturned. So thank you for your time. Obviously, you can definitely find out more about what Immunocine does online at immunocine.com. That's immunocine.com. We're also on social, LinkedIn, Instagram, YouTube. You can find me. Matt Halpert, PhD, is my Instagram handle if you want to tag into me. Reach out to us if you have questions. We're here to help. We put everything we can into each case and to each review so that we can put patients in the best position to respond, whether it's with us or whether to go see Dr. Rubin or to talk to your oncologist about something specific. We try and help. We try and put people and patients on the right path forward to truly overcome their cancer and get back to living life the way it's meant to be lived. So with that, Dr. Rubin, I thank you for your time, and I thank all of you for listening to us and wish all of you nothing but the best. Thank you.
Thank you.